Hi, this is Dr. Amy from Kidstown Dental, and what I wanted to describe in this video is the difference between a tongue tie and a lip tie. A tongue tie is a description used when a tongue doesn't completely separate from the floor of the mouth. In utero, babies have webbed fingers and toes, and that apoptosis is programmed cell death, and that's when the fingers and toes become separated by that process. So a tongue is a part of the floor of the mouth in utero, and it begins to separate to drive the growth and development of the face, jaws, and airway. When there's an incomplete separation, it's a midline defect. There are embryonic fibers that don't stretch and restrict the function and range of motion of a tongue. So a tongue tie, in the past, we didn't know as much as we do know now, but now there are validated assessment tools and protocols to use. And so if someone actually does a validated assessment or protocol, not just simply looks in and says, I think it's okay, you should question what the protocol or assessment they're using is to know whether there's a tongue tie or not if they're looking at your baby or child. But if you have a validated assessment tool used and you are in fact diagnosed with a tongue tie, it's not going to change or stretch or go away over time. A tongue tie is a tongue tie. And there's no such thing as a mild, moderate, or severe tongue tie. Saying that there's a mild tongue tie is a little bit like saying a woman is mildly pregnant in the first trimester. You either are pregnant or you're not pregnant, and you're either tongue-tied or you're not tongue-tied. If you are tongue-tied, because of the mountain and volumes of research showing the negative effects of a tongue tie over the course of a life, you should definitely look into having the tongue tie treated, and that treatment should include pre-work and then a functional release and post-work to get the most out of the surgery. So a tongue tie is there's a validated protocol and assessment. You either are or you're not. Research shows that whatever you're born with, it's not going to stretch or change over time, so it's not going to go away. What's mild or moderate or severe are the effects of the tongue tie in that person's life at that point in time. So I've seen babies with anterior tongue ties who someone might say that's severe, who are having no trouble with breastfeeding because their mom's breast anatomy and breast milk supply are compensating for that baby. I've seen other babies who have what would look like a mild tongue tie to someone because of where it's attaching or just how it looks to the eye, but that mom is having severe problems with breastfeeding. The babies may be having failure to thrive, reflux, lots and lots of issues. So that's causing severe problems for that baby at that point in time. It's really hard to predict. You may see another video of mine where I describe some of the risks of an untreated tongue tie, which you can look in PubMed and see lots of connections, associations, and direct links of problems from tongue ties. But what's mild, moderate, or severe is at that point in time how the tongue tie is affecting you. And it's hard to predict when I see parents of a toddler if they're going to have the problems with speech or feeding, or how severely it's going to affect their growth and development, or when sleep apnea is going to be a problem for them. So just like you wouldn't go to the doctor and have them say blood sugar is a problem, but let's watch for the symptoms of diabetes before we do anything, similarly it's not wise to know that there's a tongue tie diagnosis and do nothing about it. A lip tie, on the other hand, is the description of this attachment right underneath the lip. In babies, there was a recent article that came out, a research paper that showed 84% of the time infants look tongue-tied to sort of the untrained eye. And there isn't a validated protocol to say this is a lip tie or it isn't a lip tie. You may hear of classifications, class 1, 2, 3, or 4. A class 4 lip tie describes when you lift the lip, the fibers are going all the way around to the roof of the mouth, and that would be called a class 4 lip tie, but not necessarily a tie, but a class 4 attachment. The problem with that system is that it doesn't do anything to describe function or range of motion. So if you have a class 4 attachment, for example, and it's going all the way around and it's thick and fat, but you can just go like that very easily on the baby, then it's really not a restriction. What needs to happen in breastfeeding is the lips need to go out so that the wet part of the lips are on the breast or the bottle, so that they can open wide. They're not restricted because of restrictions here. They can open wide. The lips can flange out a little bit like a fish, get a good suction. There should be no leaking of milk or taking in of air. One of the #1 causes of reflux is taking in air. So the lips should flange out and get a good seal. and no matter where it attaches, that's great function of the lip. If the lip's attached higher up and it's skinny and it doesn't look restricted, but when you try to move it, it hurts the baby. And mom has the baby on the breast and she's trying to get that good seal so that the baby's not taking an air or leaking, but she's not able to do it because the baby backs off and has a shallower lash or has pain. Well, that's a restriction. The lip can't do what it's supposed to do. And so it really doesn't matter where it inserts or how fat or thin it is. It's about function and range of motion. And my recommendation would be, if you have any questions, to meet with the IBCLC, because they have loads of tips and tricks on how to help you get a good seal, a good latch, and most IBCLCs should be able to tell you whether that lip is functioning as a lip tie or whether it's just fine. The last thing about a lip tie just to know is, even if you get through the breastfeeding, bottle feeding years and you are doing just fine with the lip, if the lip is really tight to the gums, then when you go to brush teeth, it's hard to get the toothbrush in there and clean the teeth. That can be the second time a lip tie causes problems in anywhere between 6 months and a couple years old, where the child might have cavities because milk or food is staying on the teeth because you can't clean it very well. So if you get through those years and then you get through the issues with cleaning the teeth with no problems, the next time you would address a lip tie would be if it was causing a gap between the teeth, and that would be your pediatric dentist should tell you around 5 to 7 that you may need a little frenectomy, so that when the adult teeth can come in, they can come in together without a gap. If you wait till they all come in, then you'll need braces to bring them together, but you'll still have to do the frenectomy so that they don't pop back open because those fibers are going between them. So that's the difference between a lip tie and a tongue tie. I hope this has been helpful. If you have any questions, feel free to contact our office, Kidstown Dental, at 281-394-7040. Thank you so much.